Hello again, everyone. Welcome back to my YouTube video channel. I am excited to have Dr. Leon. David Leon is on my channel. He known as Dr. Homie in his channel, and he got his social media things going on. And I'm excited to see what we can work together and bring you guys some kind of common ground, sharing some kind of vision and knowledge about medical dental work together. So Dr. Homie, welcome to the channel. I'm excited.
Thank you. Thank you. Thank you for introducing me. That was a great introduction. I'm Dr. David Lyons, and I also go by Dr. Homie on my social media platforms. I'm a family medicine doctor in South Central LA, and I provide care to the general population there as a primary care provider.
Awesome. I'm, I know you. We've been arranged this for almost like close to 3 months. Finally,
Yeah.
together. So I know your time is just so tight, just at my time, and we never get a chance to do it. And
I mean, the life of a professional, right? Especially when you're trying to outreach to the community.
Exactly. Today, my son is on a Boy Scout trip, and then I'm like, oh my God, let's just get him, Dr. Homie, on the channel, and let's talk a little bit about his passion about his social media, and he's been doing so much stuff out there and teach people just some basic concept about medicine. I watched your channel growing on TikTok and Instagram and YouTube, so I'm excited.
Me too.
Give us some background, like how did you come about to become a doctor? I mean, were you intend to become a doctor at the beginning, or?
I mean, I've always thought becoming a doctor would be awesome. All right. And I've thought that for, since I was in middle school. I just never actually thought it was something that was possible for me specifically. I come from a low income background, unfortunately. I didn't have, I'm the first doctor in like my bloodline, my family. My mom being the youngest of 14 as well, I'm actually the second to youngest cousin out of all my cousins. And I'm definitely one of a few, a small handful, I think there's 3, maybe 4 of us who actually went to college.
Wow, I see. Right. And tell us, I talked to you almost a few months back, but you have a story that very unique, and how you become a doctor. It's not just a very simple journey, but my journey is also not a different journey, but from what I see, what I heard from you, your journey should be sharing to the kid, because the pre-med student or high school kid, who love to strive to become some kind of healthcare profession,
Absolutely.
but if they fail, they would be like, oh, I'm done, it's over, my life is done. But your journey is just one of the journey that I very admired, and I think that is something, if I can ask you to share on my platform, to allow the kid to hear from a doctor point of view, and how you become a medical student, then the doctor, and it's just beautiful. Please share that, Dr. Homie.
No, for sure. So I'm the child. My dad was in the military, and my mom is a first-generation immigrant from the Philippines. Unfortunately, when I was 3, my dad was forced to leave the military under honorable conditions. And since then, we did move a lot for financial concerns, as especially around the time that I was 9 or 10. Unfortunately, both the stable jobs that my parents had, they were laid off from, and they just sort of went from job to job until after I graduated high school. So during that time, we lived in several places in Southern California, from Long Beach, San Pedro, Torrance, San Diego. I lived right next to the border of Mexico and San Isidro. And growing up in kind of like this unstable, just location in and of itself, I didn't have a whole lot of connections and grounded networks, which left me kind of vulnerable, especially when my parents were always working, struggling paying bills, lots of fights in the house. I got sucked into a lot of really, really bad groups. I did start working when I was 14 because I wanted to be able to like help in the household. I had that pressure. But also I did fall into bad habits, as in like by the time I was 11, I was smoking cigarettes. By the time I was 13, I was smoking marijuana. And by the time I was 15, I was smoking crystal meth. So I was not in a good place. I was also hanging out with a lot of the bad crowds. And, I was well on my way to not doing well. By the time I was in the end of my junior year, I was, on my way to dropping out of high school. My older siblings actually both dropped out of high school and didn't get their GED until later. But one day I actually had a school counselor, Miss Yamada, who, took one look at me and just sort of said, this guy, I've seen him around. He's doesn't seem to like actually be a bad kid. Maybe something else is going on. And so she actually provided me with the kind of validation and encouragement that I hadn't experienced before, to make me feel like, I was more than just, someone who's going to drop out and end up working or end up on drugs or dead.
So that was a high school counselor?
My high school counselor, yeah. Just my high school counselor. She even like invited me into her office once and sat me down on her desk to watch this video. This was like before YouTube. So she found this video that was sent to her. And she even like left the room and gave me my privacy, even though I looked like someone who would like steal whatever was on her desk if it wasn't bolted down.
I see.
But this video, all it was was it shows a picture that was zooming into kind of like a forest with a waterfall in the background. The song "In the Eyes of an Angel" was like playing in the background. It's super corny. And then all of these little like just messages pop up on the screen saying things like, you are worth it, you are valuable, things like that. And almost immediately I just had Niagara Falls on my face. I was very, very touched and very, very encouraged by that. Both, the video as well as her willingness to kind of like reach out. And since then, I've just sort of started turning things around a little bit. I did end up graduating high school on time with a 2.3 GPA, but I also ended up after high school wanting to even pursue college. And so I went to community college. Unfortunately, things at home were still pretty unstable and intense and pretty toxic. So with my first FAFSA paycheck, I actually bought my first car, which everyone's first car should be a piece of crap, because it was. And mine, there was one time where the muffler fell off while I was on the freeway. I ended up living in my car for like after my, at the beginning of my second semester in community college. And I sort of couch surfed for a couple of months until I was able to find a stable place with a roommate. Unfortunately, drugs were still kind of an issue in there. Even when I like was able to quit, that environment became very, very toxic and conflict ridden, because, I was no longer doing those sort of things. And then from there, I did end up joining the Navy. I felt like, going to school, unfortunately, wasn't really possible at the time. And by joining the Navy, I was allowed to have kind of a stability that I didn't have before. I always had something to eat. I always had a place to sleep. And I had a job to do, which I ended up becoming a medic. And still up to this point, even though I was interested in being a doctor, never would have thought it was something that was possible. And now I'm a medic. I'm seeing patients in the clinic, similar to what an MA or LVN does, but as a corpsman in the Navy, which is what I was, we actually had a lot more privileges to see, treat, write the notes on the patient, kind of like similar to how a medical resident acts in residency, where we see the patient, present it to the attending, and then they kind of confirm or deny our diagnosis and treatment. And I still remember the first time where I felt like so grounded that this is the field I want to be in. I go into the elevator at my barracks, and a guy that I treated, and to be honest, I didn't really remember because we treat a lot of people. And he was just like, "Oh, hey doc, how's it going?" And I was like, "Hi, you know, what's up?" And he was just like, "Oh man, it's good to see you. Hey, I'm feeling a lot better. I'm able to walk on my leg now." And I was like, "Oh, that's great." And like just that appreciation, knowing that I was part of that, and that he appreciated me for, you know, helping him feel better. You know, I've never felt that sense of gratitude, that sense of like importance. And so yeah, after the military, well, I first ended up getting deployed to Fallujah, Iraq in 2008
I was
for,
gonna ask you like, did you travel? But that's amazing. Yeah. So you have
yeah,
experience of traveling around the world, I guess.
I mean, not around the world. Unfortunately, the only place I went to was Fallujah, Iraq.
Iraq.
You know, I was stationed in Camp Pendleton. I ended up going to kind of like a Marine Corps boot camp type training for corpsmen, and then
Mhm.
got attached to a Marine Corps unit and deployed with them.
I see.
When I got back, you know, I just sort of like finished everything and went back to college after that. I started back at the same community college I tried going to
How many years
after high school.
you might if I ask you how many years did you do
I
the
spent 5 years in the military.
5 year?
Yeah, five
Wow,
years in the
wow,
military.
wow,
2 in the East Coast, 3 at Camp Pendleton, and 8 months of that was in Fallujah.
wow. Well,
Yeah,
amazing. Continue, please.
yeah, it was definitely experience. I would not want to go through it again. There was a lot of fun things about the military, but you know, being an enlisted, you know, uh, uh, Navy sailor, especially like, you know, it doesn't matter whether it was like on the blue side or the green side of the Navy. You know, it was pretty rough. You know, like it's not the same kind of freedoms that we have as civilians, let alone a white coat professional.
Mhm,
Um, but so I did end up getting out and then going back to college. I ended up transferring from community to San Diego State University.
mhm.
And while I was there, one of the things that since I did have the GI Bill, I was able to use that to pay for my living expenses while I pursued, you know, becoming a pre-med and graduating undergrad. It allowed me to kind of like, you know, be able to do the various works I wanted to do to become competitive. And somehow, not exactly sure how, I got into UCLA Medical School. So, you know, I'm pretty sure like the universe like just opened up and smiled at me and was like, "I'll give you your day today." Um, but while I was there, you know, you really do get kind of like put in your place because I mean, granted, when I was an undergrad, I felt like a smart guy. You know, I was finally knowing how to study. I was dedicated. I had a lot less distractions, a lot less stresses. And I was always able to do really well in my classes. Interestingly enough, I had only a 3.4 science GPA, which technically is not competitive in a lot of people's aspects. Still got into UCLA, but I had 2 Fs from when I was in community college, because that was the time I didn't know what dropping a class or taking or withdrawing a class meant. And so when I was couch surfing and homeless, you know, I ended up taking Fs in those classes. But I was still able to get in. And then when I'm in and I feel like I'm a good student, you know, I'm super motivated. Oh my God, take like the top 1% of every single class you've ever been in and put 180 of them in one class, and we
Right.
still get like put in our place. So I was able to, you know, pass on my tests and do well. I didn't get held behind, fortunately. But I did want to feel, I wanted to feel like I did want to do more than just medicine. You know, I went into medical school wanting to be a surgeon. You know, a lot of us kind of like have this idea, but I found that I wasn't really for the surgery culture and lifestyle. I love surgery, but the rest of it just didn't really work with me. And as I kind of grew to um, be more interested in community medicine, reaching out. I learned that I have this passion for helping people who came from similar backgrounds as me, especially to try to reach their full potential. At-risk adolescents, transition age youth from the foster system. So I ended up doing my master's in public policy, not in public health, which a lot of my other colleagues did who had same aspirations. But I had this impression that there was a lot of people who would go into public health, but unless it was actually made a law and put into practice, it's not going to do anybody any good. So that's why I went into my master's in public policy in between my third and fourth year of medical school. So I ended up graduating UCLA with my medical doctorate and my master's in public policy before going to residency in East LA at White Memorial, where I spent the next 3 years. And my last year of residency was actually the pandemic. I start my second year of residency was when the pandemic started in about February, March of 2020. And June of 2021 was the end of my residency. So I got to spend the latter part of my residency during the pandemic in the worst place the pandemic had hit. So I was actually senior resident during the worst surge that we had in LA. This was before the vaccine. And man, I will tell you that after that, because I actually had a lot of colleagues who have various views, but now when it came to the pandemic and whether it's real, whether it's serious, after that, I just completely disconnected from everyone that, would speak about the pandemic in that way, just because they were the ones who I felt like were causing more people to be sick than would have otherwise. And people were dying left and right. And we were so overpacked. Usually I would see a team of 5 of us would see 16 patients. I would be the senior to kind of manage the more severe patients and make sure my juniors were, doing their stuff okay. But during the pandemic, we got up to 50 patients in our team, and 100% of them were COVID. We had to separate patients like that. So it was very, very difficult to, keep them separate. We had patients getting dialysis in hallways and procedures in hallways. It was terrible. And it also made me realize that, as a professional, as a white coat professional, as a physician, I did have a voice. I did have influence. It was something I was still kind of gaining acceptance of, because I still very much suffer from the dreaded imposter syndrome, where I just felt like I didn't belong because for some reason I don't deserve to be here, even though I did everything everyone else did to come here. But as I started realizing that I had this voice, I have this influence, I have this knowledge and expertise, I wanted to share it. So I made the active decision of being more vocal online on social media. And it wasn't until me and a friend of mine were kind of discussing ways that I can do that we came up with, coming up with a social media platform where I can provide that sort of information. And so I took a poll from some of my friends, and Dr. Homie came to be. And so I used Dr. Homie as a way to disperse and provide verified medical researched data, research supported data and advice to patients who wouldn't be able to get it otherwise, or so that way they can have it much more easier. Because unfortunately in this in the medical field, sometimes getting an appointment is the most inconvenient thing. You have to book 3 weeks, 3 months ahead of time just to be told something you could have been told within 5 minutes, if only, right? So, people work, people have lives, and especially in my population of patients, nobody has any time. They're constantly worrying about so many other things. So I want to meet them where they are. If they need a little bit of advice on how to treat their, onychomycosis, their toenail fungus, or how to breastfeed properly, or what are the resources for breastfeeding. I want to be able to provide that and have that available for them, and it be something coming from me. And I would tell this to my patients in an exam room if I saw them officially. So that's where I am now.
I love, brother. It's so beautiful, and it's so touchy to the story that you were talking. All of the detail, it's just beautiful, and that's the reason why I would like you to be on this podcast, because exactly what the podcast is all about is to bring the information to a general public, but also like the story that how you become a doctor. It's just like if you never told anyone, and this is something that you are so kind and humble enough that you share to on social media like this, and this is something that I really appreciate, because you actually share a lot about your personal information, and this is just wonderful, because a lot of kids nowadays, the parent push them so hard. They grow up from a good family. They have they have all the resource, and then they
Yeah.
mistake, and then they feel like the world is coming down and it's the end, and they doing a lot of things that is unnecessary, like thinking about commit suicide or changing career.
Yeah.
Or they haven't even tried hard enough. Like your life, it was been just like, uh, can't describe it. It just, if you have
It's been
it, that,
challenging.
yeah,
Definitely challenging. And when it comes to, like, those kids who have all of that pressure from their family, because one thing for sure, especially in medical school, let alone being a pre-med, there is a unfortunately high rate of depression and mood disorders, and especially once you get into medical school, the one statistic said that you're 100% more likely to commit suicide. And while I was in medical school, although fortunately no one in my class has committed suicide, in neighboring classes, like say at a neighboring med school, there was an instance of suicide where we, talked about that. I learned recently, a couple of months ago, that one of my co-residents committed suicide, and it's
what's the reason,
devastating.
Dr. Leon? What the reason? What the reason why they commit suicide?
I mean, like I said, that pressure to be perfect, that
Mm.
pressure to do everything right, and feeling you're not good enough, like you can't do it, like you have wasted your entire life, and by not being able to make it the way you perceive you have to, you're therefore a failure and not worthy of moving any forward. And people will ruminate on this and fall into that spiral of depression. And one huge issue in the medical field and among physicians is this negative bias that having mental illness is not something you're supposed to be dealing with. I have personally been in therapy and mental health treatment for 15 years minimum, like 17 years or so. And it is something that has been necessary for me in order to thrive.
Mm.
And some people perceive that as, a weakness. And in the case where if you need help, they will foresee getting help as, a negative factor that will further hurt them, and then ultimately spiral down to taking their own life, because it just becomes too much, and they just don't have that ability at the time to reach out and be able to get the services that they need. So a lot of medical schools and residencies really need to step up, and they're only barely touching the surface on the kind of treatment, the kind of preventive measures that need to be put in to ensure the safety and the mental wellness of white coat professionals, especially whether it's physicians, dentists, nurse practitioners, physician assistants. We're in a time where we're vastly outnumbered by the patients. Just like it's overwhelming. And to have that pressure from, higher ups, to have that pressure from within, from our families, it just becomes overwhelming. I have failed a lot in a lot of different things, I still remember the first time I failed a shelf exam during my third year of medical school. I thought I was going to be kicked out of medical school. I thought that was done. Like, I'm just like, that's it. Okay, I'm officially not worthy of being a doctor. I was wrong, very wrong. And I put myself through a lot of unnecessary stress because of it. Not only did this not affect me becoming a doctor, I mean, I still remember walking into the room. One, you just retake the shelf test. And then when I walked into the room in order to where I was supposed to retake the shelf, there were a ton of my classmates in there. So it's like, no, like we need to stop putting so much pressure on ourselves. Obviously, there is a stress curve. Sometimes people's productivity really flourishes the more stress they have, but there is a peak. And once you hit that peak, you crash. And
Yes.
so, there's a lot of unnecessary stress that we put ourselves in, that unfortunately really affects our ability to move forward in the field. And I feel like, yeah, a lot of times it's just just having that one person to let us know it is cool, it is okay. I went through this, you're going through it too, you can get past it.
Oh my goodness! The talks today is help not only just the resident, the medical student, the medical doctor, but also I want to go back to the talk today that you share your story about how you struggle with the GPA before your pre-med school.
Yeah.
This is something I want to repeat again, because a lot of dental student or medical student, when they see this, I'm sure there's so many of them out there. When they fail, they get an F, a D, a C. They really think that this world is over for them.
Yeah.
It's over. But in your
But
case,
that's not the case at all. Not at all. I mean, I'm not the only one who has Fs and became a doctor. I have a colleague of mine who applied to medical school at the same time. She double majored in I forget what she doubled, but she did a double major, but her GPA was like a 2.9. It was bad. At least as far as medical school is concerned, right?
yes.
She ended up doing a post-bac, which didn't take a whole lot of her time. She significantly improved her GPA. She did a 1-year master's, which also, again, improved her GPA. She learned from her mistakes when it came to stretching herself thin, how much time she needed to study. She just kind of kept at it and just improving the areas that she just wasn't really doing as well in. And that's something that the field, the schools, the professional schools do look at. They see, and I have had the privilege of being able to, be part of the application process, of the acceptance process in my medical school for a brief period. And, we see people who start off, a little rough, but then just rise and continue to rise. And so, like I said, my friend who, even though the GPA just wasn't great, hers ended up being like a 3.3 or something, a little less than mine. She still got 3 more acceptances than I did, including one of them being a full scholarship. So she's now like a family practice physician as well. I'm trying to get her to come out to LA because I really want her. She's like an awesome, comes from a similar background as me. But she's practicing, we're out there, and we made it. We stressed like crazy during the time. Obviously, in our particular cases, we had no older brother, older sister, parent, or family member who was also in the field who can kind of help us through those things. And so it was really difficult. But now that we're through it, yeah, telling people who don't have that reassurance letting them know that, yes, you may have a not so great GPA right now. That doesn't mean that you can't improve it. And that doesn't mean that you can't become that white coat professional or that provider that you want to be, because obviously it happens.
I completely agree with you. I just want to share you a quick story about my side. You know, I have a very young cousin, very young one, and the story that you told that, you know, didn't do well in first 4 year, get a like a 2.9, very
Yeah.
similar, and a lot of pressure from the family and friends, and he was just ready to do bad thing too. And I told him, look at my eyes, you know, you can become a dentist if you want to. And you have one choice. You decide to go forward with your determination, or you going to go backward. And, you know, he listened to me, you know, did a bachelor, get a good, really good grade. And he got into
Nice.
school, you know, and
There you go.
and you know, even to get to a point where he got the going through the interview process, he want to, he doesn't think he's gonna make it, you know. That's
Yep,
how bad it is. So, you know,
it is.
I can't wait. We're gonna continue the journey with a deeper, detailed little trick for every, you know, a student or dental medical student, and we're gonna talk and share it again, because this is something that it allowed us to really just freedomly share our experience and what we've been through. And so your story, Dr. Leon, is just amazing. I really appreciate the time and the humble and the genuine, you know, the genuine that you share without you know, hold back. And because this is important, because we want to use the channel to spread the knowledge, the experience that we went through. And so it's wonderful. And so, wow, beautiful. It's almost 40 minutes. And
Wow.
we want to do, if we want to stop now, so that way next time people hear you guys, if you like what you hear right now, you check out Dr. Homie social media. You want to learn about medical information. And of course, we're going to invite him back for very small tip each time. So much to share, Dr. Leon, Dr. Homie. I appreciate your time today.
I appreciate
Can't
it
wait to
too.
do it with you a lot more time.
Yeah, I'm looking forward to it.
Have a good day, brother.
You as well. Take care.
Thank you.